How to cope with endometriosis. In this video, I will be talking about the challenges faced by people with endometriosis and how to cope with them. Towards the end of the video, I'll be talking about what needs to be done to offer more support to women with endometriosis. Endometriosis is a mystery. We do not know what the exact cause is or why it causes severe symptoms in some women and not in others. Endometriosis is not well understood by the general public due to the fact that its symptoms involve menstruation, relationship difficulties, infertility, etc. These symptoms are often thought to be taboos and they're not spoken about freely. When patients have complained of their symptoms, they often felt that nobody believed them. There is a lot of frustration all round on the part of patients and doctors alike. The patients get frustrated at not getting a timely diagnosis for their symptoms, and when eventually diagnosed and treated, the treatments for some women may not be effective. The doctors are left feeling somewhat defeated as they cannot give any guarantees that any of the treatments offered will be effective. Welcome to Shalom Health, a channel where we aim to empower you to lead a better and healthier life. Please like, share, or subscribe if you find any value in this video. Challenges to living with endometriosis. You may feel isolated and alone whilst trying to get a diagnosis. This may take anything up to 7 years on average due to so many factors. There is another video on this channel that deals with why it takes so long to get endometriosis diagnosed. Please watch it if you can. People who have endometriosis commonly miss out on social events and activities. The pain of endometriosis can lead some women to change their lifestyle by avoiding socializing with others or engaging in exercises. Another challenge is in the area of the severity of the endometriosis pain being enough to lead to challenges with physical intimacy with your partner. Problems at work due to the need to take time off work with the possible consequence of reduced productivity, and there may be difficulty with caring for family members, e.g., husbands, parents, children. Other challenges: lack of knowledge about the condition by members of the wider community, uncertainty about future fertility following diagnosis, and feeling of anger and resentment. Because of the various challenges, it is a good idea for women to consider joining endometriosis support forums. This is one of the better ways to cope with the various issues. Instead of feeling lonely, you actually have more in common with other women who also have endometriosis. If you join an endometriosis forum, you can get to share physical, emotional, and social experiences with these women. Their stories may help you to identify symptoms that you may not otherwise have realized. If you engage with a support group, you will be in a position to talk openly about the challenges that you're facing in aspects of your life. They are there to offer a safe haven when you need one. You can be free to be yourself without being judged. The social connection on forums often improves the quality of life and empowers women to make informed decisions. You can learn new coping skills, new ideas, and new actions to possibly take. They may also help with suggestions for referrals to professionals that they have found helpful. Examples of forums are endometriosis.org, Endometriosis UK, Endometriosis Australia. There are also forums on social media sites like Facebook, Twitter, etc. Become a self-advocate. Endometriosis is a chronic condition that lasts months to years. So it is important that you try to become a partner in your own care. Try to form a good relationship with your doctor. If you're not satisfied with the advice of your healthcare provider, you may wish to seek a second opinion. Have a strong support system. Involve people in your life, family, and friends. Let them know exactly how you're feeling. It is a good idea to try to educate them about the disease. Skills for self advocacy. Trust yourself. You know your body better than anyone. Don't minimize your symptom or say it's probably nothing. Be confident and ask questions when the information you're given is unclear. Make a list of questions you wish to ask before going in to see the doctor so that you don't miss out on anything. You may take a family member or a friend if you wish. Do your research. Steps to cope with symptoms. Engage in health promoting activities such as having healthy diet. Diets high in animal products and red meats can increase estrogen production, which can make the growth of endometriosis worse. A good diet for endometriosis would include vegetables, fruits, whole grains, and foods rich in omega-3 fatty acids. Avoid processed foods and food that contains trans fats. Limit alcohol and caffeine intake. Physical exercises. Exercises may be of help in endometriosis. It encourages circulation of blood to the organs. It maintains nutrients and oxygen flow to the organs. It decreases estrogen production. It reduces stress by releasing endorphins in the brain, which are pain relieving, feel good chemicals. Restorative sleep. Good quality sleep is important to rejuvenate your body. Aim for 7 to 9 hours a day. Stress reduction. People who have endometriosis have pain, which may affect most, if not all, aspects of their lives, relationship, and work. This in turn causes stress. Endometriosis pain in turn can be affected by stress. Stress relieving measures include deep breathing, mindfulness, etc. Medications. Painkillers may be bought over the counter or prescribed. Hormone therapy. This helps to slow down the growth of endometriotic tissue and thereby reduces pain, e.g., contraceptive pills and patches. GnRH agonist and antagonist to reduce levels of estrogen, e.g., danazol. Progesterone only contraceptive can also be used. These come in the form of implant, tablets, or injection. Vitamins and dietary supplements. Vitamin D may play a role in endometriosis. Vitamin A and vitamin C have antioxidant properties. Alternative therapies, for example, acupuncture. This may interfere with pain pathways and increases the release of endorphins, which relieves pain. Please note that this is not backed by strong scientific research evidence, by which I mean the acupuncture. We're now going to talk about other coping mechanisms. As mentioned before, endometriosis has significant impacts, not only physically, but socially and psychologically. Examples of positive coping mechanisms are acceptance. Acknowledge the fact that you're experiencing pain. Optimism. Stay hopeful whilst at the same time be realistic about the diagnosis. Engaging in healthy lifestyle. Stay healthy and functional as much as you possibly can, rather than becoming non-functional. This gives you a feeling of being in control. Other examples of positive coping mechanisms are tension release. It's perfectly normal to have a cry to let out anger and despair. Get social support from doctors, family, friends, endometriosis groups. Take control, take charge, research about the condition, become an active participant. Prioritize. Assess your goals and reorder them to see which ones need to be shifted, e.g., decisions about relationships, childbearing, etc. This helps to avoid the feeling that your life is on hold. Examples of negative coping mechanisms are denial. Some people deny that the disease may become chronic with the attendant threat of recurrence, infertility, they become angry and stressed. They're more likely to delay getting treatment. Negativism, focusing on the worst possible consequence of the disease. Avoidance, try not to think about endometriosis by engaging in other activities like sleeping, reading, surfing the internet, social media sites, or watching TV. Withdrawal, avoiding socializing with friends, staying in bed for longer. Passivity, that is feeling of helplessness, wanting to be looked after by other people. Points to note: avoid self-sabotage. Don't compare yourself to others. Focus on things you're grateful for in order to help you build mental resilience. Keep a symptom diary. Note when the pain is better and when it is worst. Adjust your activities accordingly. Be aware of your emotional triggers. Take note of how your moods are during your periods. Communicate your feelings to others and let them know ways they can be helpful. If you have not been fortunate enough to find a treatment that takes care of your symptoms adequately, you may wish to consult other providers like psychologists or nutritionists, depending on your particular area of challenge. Going forward, cooperation will be needed between health professionals, psychologists, and support organizations to provide care and find solutions to the needs of women suffering with endometriosis. In the meantime, let us continue to raise awareness of the condition. You can start by sharing this video, liking, or subscribing to our channel. Disclaimer: the information on this channel is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. All content on or available through this channel is for general information only. No professional relationship is formed between any member of Shalom Health and yourself as a result of getting information from this channel. You are encouraged to confirm any information obtained from and through this channel with other sources and review all information regarding any medical condition or treatment with your physician. If you have found any value in this video, please give it a like or comment on it to give us your thoughts on the ideas discussed. And please share with the people in your life who might benefit from this knowledge. Make sure to subscribe to our channel for more eye-opening content like this. Stay curious and stay informed until next time.